The trend of drawing more tax money at a problem is not restricted to medicine. The earliest historical case was in the railroad industry, where the railroad entrepreneurs helped to impose on us the Interstate Commerce Commission, followed by many other government parasites. Similarly, we have been seeing much greater government involvement in medicine as well. Medicare, Medicaid funds, expenditures by the Department of Health, Education, and Welfare for other medical purposes. Spending on medical care leads to control over fees charged, as it should, since the government wants a return on its investment after all. Control over fees leads to control over practices that are followed, which leads to socialized medicine. This trend harms the interests of patients, physicians, and other healthcare personnel. How? There are many reasons and examples. Let me explain. Most policies by the American Medical Association were adopted in the name of improving medical care. Well-intended policies, which were regarded as desirable in practice, had the effect of restricting entry into medicine, holding down both the quantity and the quality of medical care. American medicine has improved not because, but despite all these regulations. It remains a field with many innovations. Initially, it might appear that there are additional resources when tapping into the governmental funds, but this is a transitory phenomenon. Once government takes over, it needs to continue taking over other industries to get votes and provide special interests, so the areas that have already been taken over get starved. An obvious example is Great Britain. Nationalized medicine was introduced to Britain immediately after World War II. A British physician, Dr. Max Gammon, developed what he called a theory of bureaucratic displacement, where he showed that an industry, after being taken over by the government, tends to replace useful work with useless work. He illustrated in his study that no new hospitals were built for the first 13 years after National Health Service takeover. He examined the 8-year period from 1965 to 1973, in which the number of hospital staff went up 28%, while administrative staff went up 41%. He also measured output by the average number of beds occupied daily. It turned out that the average number of beds occupied daily went down by 11%. It was not from lack of patients. At all times, there was a wait list in the neighborhood of 600,000 people waiting for hospital beds. I must also add that 2/3 of those beds were in the hospitals built before 1900 by private medicine. Meanwhile, as expected, 1/3 of graduates from medical schools immigrated to other countries to practice medicine. Back in the United States, you hear presidents and politicians talk about expansion of Medicaid, Medicare, and FDA. They mention the terrible rise in hospital costs, which American people cannot afford, but wise government bureaucrats will eliminate. Except there is only one source from which they can cover the costs: American people. On one hand, costs have gone up because of government involvement, but on the other, because the public at large wants to buy more and higher variety medical care. In fact, the costs of ordinary medical care are well within the means of average American family. The public spends more money on housing, automobiles, alcohol, and even cigarettes, which are ways to increase your medical bills, not reduce them. The variety in costs can always be handled through the availability of private insurance arrangements. So we're not talking about sums of money that are beyond the capacity of individual family at all. To be clear, I'm not objecting to people smoking or drinking. People must be free to help or hurt themselves as long as they do it at their own expense. There is an arrangement to be made for the government helping people who are in dire distress to cover major medical bills, just as some may need help after losing homes in a flood or hurricane. But that's not a major expenditure. The only other situation that used to have positive arguments was government involvement in public health activities during an epidemic. But after seeing how the latest one was handled, we can all agree that the government caused more harm even there. The right cure would be all the way: no government regulation, no government subsidization, and a point which is equally important, no licensure of physicians. This is the only way to reduce and eliminate the monopolistic powers of the American Medical Association, which holds control and allows practice of medicine only if you're licensed by the government. I realize that it is a shocking statement, but it is not a casual comment. The strongest case of having licensure is in medicine, but in my next video I will explain why the licensure of plumbers, beauticians, accountants, and other professions is not a beneficial practice. When people are asked, do you favor the monopolistic practices which the American Medical Association has followed over the past 80 years? Most will probably say no, but when asked, are you in favor of permitting unlicensed practice of medicine? Most will say no again. I urge those people to pick which one they want to believe, because they cannot believe both. But how do you fight the problem of inadequately trained individuals and fraudsters who will take advantage of people when practicing medicine? Well, just because a doctor was licensed 20 years ago, he or she might be completely incompetent today, and we all know such doctors. So a license is not an assurance of quality. And of course, if I pretend to have graduated from Harvard Medical School when I didn't, I should be sued for fraud and misrepresentation. However, there are a lot of professions that don't require licenses, yet very few are able to practice it successfully without having good training and skills. In reality, the assurance comes not from the fact that I can personally judge the best doctor. When you buy a car, you get the assurance from the middleman. When buying a t-shirt, you get it from the department store. When you go to a doctor, you get your assurance from Mayo Clinic, Kaiser, UCLA, and other known hospitals that hire the well-trained professionals. No business will stick around for too long if they provide a bad quality product. Next, the fact that you have had licensure had made it much more difficult over decades to eliminate low-quality practice. Doctors who speak up about it are risking to lose their hospital credentials by the American Medical Association. In fact, American Medical Association had a clear, outspoken policy in the 1930s to keep down the number of licensed physicians and only allow some from the list of schools they wanted. So this issue needs to be resolved at a stage of education and not simply licensure. Moreover, there are lots of medical practices that could be well performed by people without full training, which would free up the physician's time. Remember, the setting in which medicine has been practiced during thousands of years has been one in which the patient has been the client and employer of the physician. Today, the state claims to be the employer and decides the conditions, working hours, salaries, prescriptions, and the rest of the territory of the patient-physician relationship. If the battle of today is not fought and won, there will be no battle to fight tomorrow. Again, this is not simply a problem in medicine, but a general problem of going down the road to a completely collectivist society in every area, as we have been going for the past 80 years. I urge people who say we have to have government medicine, would you mind first telling me which of the great reforms of government have achieved their objectives? Did the federal housing program has solved the problem of housing for the low-income groups? Did the welfare program has solved the problems of indigenous and dependents? Did the federal urban renewal and reconstruction programs have solved the problem of urban decay? But people are slowly catching on, and it is not entirely hopeless that we can stop this march and turn it back.